Hi everyone, welcome to Mommy Wise's Live. My name is Aditi Nahata and I'm so glad that you're here today. So, as you know, at Mommy Wise, we're always here to provide cutting edge information and interviews from leading professionals to make sure that you have the best information possible. So, today's live is going to be relevant to so many of you because if you're not expecting, you might be having a mother, a sister, or a friend that is either expecting or is planning a baby. And today's live is all about giving birth, especially in COVID times. So we're very, very excited to introduce to you Miss Megha Khanduja, who is extremely talented and extremely experienced. She is a Lamaze certified childbirth coach. She is the Doula from the Doulas of North America. She is certified in giving waterbirths, and she is certified in infant microbiome and Epigenetics. So before I add it to this live, let me just give you a gentle reminder to please follow Mommy Wise to stay tuned with all the information that we provide you. So let me just add her to the live today and we can have a very informational session. In the meanwhile, if you have any questions about giving birth in these pandemic times, please do send them in the comments below. I'm just going to add her. Request. Do send in your questions. It's going to be an extremely informative session. Hi, Megha.
Hey, good afternoon.
How are you?
I'm good. How are you?
I'm good, thank you. Thank you for taking the time out for being with us here today.
It's my pleasure. Well, I should be saying thank you to you for, bringing up this important topic. Hey, are you able to see me clearly? Am I in the frame?
Yes, I can see you and hear you very clearly.
Yeah, wonderful, wonderful. Great.
Great. So, Megha, I think we should start with the first question, which I think everyone wants to know is, what is a doula and what do they do?
Yeah, sure, absolutely. Before I do that, I just want to take like 2 minutes. And first of all, thank you so much for, bringing this topic up. I think it's very important in the time of COVID and otherwise also that women should now start getting aware about this concept of a doula, a labor doula. Also, I never thought that I will ever take this up as a full-time job. My job was in a totally different arena and I had no correlation whatsoever. However, I think the birth of my second child kind of maybe made me interested to learn more about this topic of childbirth education and labor doula support. And I kind of started finding myself taking more interest in this, right? And through Mothering Mothers, I'm here to help pregnant women and their partners, minimize their fear of childbirth. According to me, I think women go through a lot in pregnancy. It's filled with anxiety, it's filled with fear, they are worried. And hence, through Mothering Mothers, we try and share evidence-based knowledge to pregnant people so that they can make informed decisions for yourself, right? Absolutely. And we are talking about doulas, and I think the value of a labor doula is huge. That I want to be sure that everyone listens to this. So regardless of where you decide to give birth, right? It's really important that you consider having a labor doula. So a doula will not only make your birth easier, but also lowers the risk of medical interventions, right? So I think that's very critical here. And there is evidence, okay, and studies to back all of this up. So the concept of doula has been widely followed in many parts of the world, specifically in the US, in the UK, the Europe side, but is recently gaining popularity in India too, right? There is now an increased awareness towards accepting a labor doula into households, right? So I'm a certified birth doula, and it's a passion of mine that I'm slowly warming up to over the last few years. My focus right now is to educate and empower expecting couples and add to their birth awareness. So to answer your question, to cut the long story short, a birth doula is basically a companion who supports a birthing person during labor and birth. We are trained to provide continuous one-on-one care as well as information, physical support, and emotional support to birthing persons and their partners, right? We provide help not only during labor and into the labor, but often postpartum as well, which is more to do with breastfeeding,
Wow.
right?
Okay. Okay.
So there are different kind of doulas, and everybody has a different expertise. But in my capacity, I will meet up with my clients mostly in the third trimester,
Okay.
and there are these multiple intake sessions which happens where we kind of understand and we try to deal with the fear and the anxiety, right, which my clients would have, correct?
Correct.
So
Correct.
we help them create a birth plan. We decide on how will you be coping with pain and what's going to be my role, right?
Right. Right.
The biggest thing about doula is that we provide non-judgmental and unbiased support, and that's something that we really strive to do with every other client, and we try to meet them where they are at, and this is very important, right? So, I would say that we are the masters of double hip squeezes. We do a lot of massages. We instill the encouragement and wisdom, and really, a doula will help a pregnant woman discuss your fears and help you and your partner prepare for birth and labor. So we are literally hand holding you,
Okay.
correct? So I think that's really, I would like to tell you in the most simplest way as to what is the role of a birth doula or a labor doula.
Okay, that's very informative. Thank you for sharing that. And can you tell me, in this process, how do husbands play a role? As a partner, do they try to be very hands-on, or is it more between you and just the mother? What is the role played by the husbands?
Well, thank you for bringing up that question. I do get that question a lot that, oh, so if you are there, will my husband be not there? Okay. So
Yes.
the partner or the father has a lot of emotional investment at this stage, right?
Right.
And how we can help as a doula is to support the dad in this emotional journey, both physically and through information,
Right.
right? It's observed, when dads know that there is a doula, they find themselves enjoying the labor and childbirth more because now they know that there is a backup, right?
Okay. Yeah.
Mentally, they become more stronger, that if in case a situation arises where they don't know what to do, so now they have a backup, right? And
Right.
many
Right.
times dads are first time dads, and they may get overwhelmed looking at the condition of the woman, right?
Right.
So
Right.
we don't want partners to feel helpless either.
Right.
And the idea here for us is to support the women in addition to the dads and not replacing them. That's a key
Okay.
word, not replacing them,
Right.
right?
Right.
And the fact is that there will be a lot of emotional aspects where dads are needed, right?
Of course.
And if they choose to be there, I think that's very important because then they can do a better job. So
Right.
there is a misconception that doulas replace the role of a husband or a birth partner. It's totally opposite, actually. The
Okay.
birth partner, and hear this, the birth partner knows the birthing mother, and I know birth. So together we can create a positive and a comfortable experience for the women in labor.
Oh, that's very nice to hear. So can you maybe tell me, what the difference would be when a woman would give birth with dollar support or without? How does that really change the birthing experience per se?
Sure. I think that's a very important point that you brought about, which is about the birthing experience,
Right.
right? And I think I emphasize, irrespective of what sort of birth you are choosing, okay,
Right.
um, it's important that you have a positive birth experience.
Absolutely. Yes.
Correct. So since time immemorial, women have been cared for and supported by other women during the process of labor and birth, right? And always had someone with them throughout, which we now call continuous support, right? So according to the latest research, and this was done by a program called Mothering the Mothers,
Right.
how can doulas help pregnant women have a shorter, easier, and healthier birth? And the findings were that, having a doula really reduces the chances of a cesarean delivery by 50%, right?
Okay.
The duration of labor is reduced by almost 25%. The use of epidural request goes down by 60%. And the
Wow.
use of artificial or synthetic oxytocin is reduced by 40%, right?
Okay.
And forceps assisted delivery by 40%. So women, and these are all evidence-based research. This is not something which I have created. These
Of
are all
course.
scientific research which
Right.
have happened. I'm quoting you the exact numbers. So women have reported a more positive and a satisfying birth experience, childbirth experience with the support of a doula, as well as being less likely to take any pain relief medications, right? So
Wow.
when,
Wow.
we are going through these statistics, I think instead of asking, why should a woman hire a doula? We should say, why not hire a doula? And I
Right.
think in the
Absolutely.
larger yeah, and I think in the larger scheme of things, doula is an expense. And if there's anything, you can do to have the birth experience you want and improve your chances of a positive birth experience, I think, with hiring professionals like us, things will definitely go smoothly and your birth plan will be carried out the way you want. So, why not hire a labor doula or engage with this person at the right stage of your pregnancy?
Absolutely. That's actually a phenomenal experience. I wish that, I knew about this when I was giving birth, because I'm sure it would have changed my birthing experience too. And I think primarily, in India, I feel in general, there's this fear that, oh my God, I just hope I don't end up having a cesarean when I know I can have a normal delivery and I want to have a normal birth. And I think that, if you're providing that support, it's a fabulous thing that you're doing. It's absolutely amazing. And I was, more absolutely shocked to hear the figure. You were saying that, you actually reduce cesarean births just by your
Yeah.
presence, and that's actually amazing. So can you tell me, I mean, now that I'm, if I were ever to have another baby, uh, how would I actually approach Doula? How would I, how does one get through this process of finding one and,
Yes.
having this relationship with the Doula?
Sure. Yeah. So, I feel most oftentimes, do a doula search in your area and or connect with your childbirth educator, coach, as they are usually aware of the network and will be able to recommend. Okay. Feel free to reach out to me. I can also help you finding doulas in your areas. Reach
Okay.
out to the birth doulas and ask to schedule a consultation. Okay, because
Okay.
that's a great chance for both of you to know each other and see if you are the right fit. At
Right.
times it takes, you to interview or consult 3 to 4 birth doulas before deciding which one is the right fit for you. Right.
Okay.
So during my, introduction sessions, typically what I do, I try to learn what type of birth experience is my client looking for.
Right.
What is the pain threshold that she has, right?
Right.
What is the support is the birthing person looking from me? And,
Right.
then I go from there,
Right.
right?
Right.
And the reason you will often hear me saying this word birthing person, because I totally believe in inclusivity. Not
Right.
every person who is giving birth is a woman. And I think as a doula, it's it's of prime importance for us to have respect for everybody's identification and the way they choose to be dealt.
Absolutely. Yeah, that's wonderful. So, what kind of, you mentioned that, we have to make sure that the doula is a right fit. So what kind of questions should we be asking the doula to make sure that, we're really, compatible in terms of, our
Absolutely.
goals and everything that you mentioned?
Okay, great. So I think that's a great question. And while going for a consult, there are some practical questions one should ask, like how long have you been doing this work,
Right,
right?
right,
What has been your experience,
right.
right? Like I personally would like to know what inspired them to get into this kind of work.
Right,
How
right.
receptive are they? Are they really interested to offer me the kind of support that I am looking for? Are
Okay.
we aligned on different coping techniques, comfort techniques? Right? You might want to go over, any sort of a contract which this labor doula has.
Okay.
Right?
Okay.
When will be the on-call procedure start?
Right.
Right? Because, see, at the end of it, please understand inviting somebody in your labor room is a very intimate experience. And you
Right.
want to make sure it's a great fit, right?
Absolutely. Yes.
Also, I want to take a moment and congratulate, our listeners that I think, you are making some amazing choices by listening to us today. You have already chosen to carry and create a life form, and then choose to surround yourself with a support system, right? So these two choices itself, I think, speaks volume, about your character. And I highly recommend you to reach out to me if you need any advice and get more insight. I'm really happy to help. In fact, if you are looking for more great information, to identify how to identify your options, right? Then, and you're looking for more evidence-based, information, do follow, my handle of Mothering Mothers. I will try and put a lot of informative posts to give you the most relevant and the most up-to-date information that can help you and your birthing partner to make the most, evidence-based decisions or informed decisions for your pregnancy.
Wow. Okay. Yeah, that's insightful. It's so nice to know that women have this option out there of getting that support, because I can honestly tell you around 5 years ago, this was not even an option,
Yeah.
So it's wonderful. I think it's an amazing thing that you're doing, because I think it's also very needed. I think there's so much confusion with, women hearing things from generations before, but not wanting that, because we're women of today, and we have all these different mindsets, and to have someone who can match your mindset and really give you what you need, I think that's absolutely amazing. So I'm so glad that you're doing this. But my next question is going to be to you. So, like you said, you help with the birthing experience. You're also certified in giving water births. So I'm really interested to know the difference between, for example, a water birth. Is that something you do at home, or do you still recommend that to be done at a hospital? Or and what about a cesarean birth? Like, how do you support that?
Yeah. So I really wish in India we had more home births. So understand the concept when you do a home, and why home births are so successful in the US or in the Europe, because in these mostly in the Europe is filled, and they have an accepted midwifery norm. So to
Right.
do a home birth, you need to have a midwife with you,
Yes.
okay, and a backup obs and gynae professional.
Right.
India still doesn't have a big practice of approved midwifery,
Right.
and hence home births are minuscule. Like, I mean, I think in the last 4 years, I've only heard of one home birth, which happened in Mumbai, right?
Okay. Okay.
So a lot of hospitals are now gearing up to the concept of water birth. And see, and I always keep hearing these questions, are water births safe? Does one really needs to go for a water birth? Of course. I mean, imagine, when we get our period pains, right? There are so many women who find comfort when they keep a hot water bag.
Absolutely. Yes. Yes.
So
That's true.
water is therapy,
Okay.
right? And
Right.
I have seen in so many of my cases where in the active stage of labor, where the woman has already reached 6 centimeter dilation, the contractions are coming together, they're coming with full force, they are very closer. And even if the hospital doesn't have a water birth, the best thing for them to do is step in the bathroom. I start off, the hand shower.
Right.
Okay,
Right.
I try to give them a massage by using the hand shower in the area where they are feeling a lot of pain,
Pain.
and
Okay.
that instantly gives them the relief. So
Wow.
giving birth in water is I think the most comforting way that you can experience this baby coming out of you.
Wow. Okay.
Right. So that's on the water birth side.
Right.
I know because of COVID, a lot of hospitals, they have kind of shut down their water births. And well, I'm no one to judge that here, but should women go for water births and water deliveries? Absolutely. It has nothing to do with COVID or no COVID.
Right. Right.
It's just a non-medical way of providing you pain relief and giving you comfort.
Absolutely.
On your second question, that how do we support in a cesarean birth? So this is what I would like to say. So, I think, first of all, thank you for bringing up that question, because, a lot of everybody thinks of a doula support only in the concept or in relation to a vaginal birth,
Right.
right?
Right.
So if somebody is planning to have, say, an elective C-section, Okay, or what if, if the women, wanted a vaginal delivery and end up having a cesarean birth, right? So in their mind, they will say, I had all these ideas about what a doula could do. I paid the money and now I'm having a surgery, so how do I support that, right? So plans change. Please understand that birth is unpredictable. Sometimes we do have clients that have a planned cesarean and still see the value in my support, right?
Right.
So we can talk about it in different ways. So when you have a planned cesarean, I think whenever you hire a doula during your pregnancy, we are still there for emotional and informational support throughout the pregnancy, right? So that, can be really valuable, right? We can also help you come up with a birth preference, right? Or a birth plan for a cesarean. When
Yeah.
most people think of a birth plan, they think of a labor and a vaginal birth, but it
Absolutely.
still applies to cesarean. So you still have choices and you can still kind of customize your experience, right? So like, for instance, you can talk to your, provider about like, a pass-through or a see-through drape so that you can see the baby emerging.
Okay.
Vaginal seeding is so important. I do conduct like a whole session on infant microbiome and epigenetics where I talk about why vaginal seeding is so important. When, and if the baby is not coming out of the vagina and for some reason cesarean has to be done, then how can still this baby get all the important microbiome from the mother?
Okay.
Right. So
Right.
there's a
Right.
different procedure which is called a vaginal seeding, right?
Right.
Skin to skin preferences. Why skin to skin is important? Because a woman's body, the skin, the breast, has about 1,000 bacteria. And when the baby comes out and he is immediately placed on skin to skin, he gets exposed to all of those good bacteria which are going to build the immunity of the baby. And then there's a good start to breastfeeding. There's immediate latching, there's immediate good start to breastfeeding, right?
Right.
So I think these are some of the ways in which doulas can help a women make those choices, whether it's a cesarean birth or whether it's a vaginal birth.
Okay, wow, that's very informative. And another question is, now in COVID
Yeah.
times, mothers are forced to choose because they're only allowed
Yes.
one person in the room, and of course,
Yes.
for emotional support and for comfort, a lot of them are choosing their partners over a doula. So how do
Yes.
you, come into that? Is it virtual or what is it that you do in that situation?
Okay, you asked me some very right questions. Okay. So, so right now with this, whole COVID thing going on, we are seeing the birth support is getting limited, and most time doulas are not allowed in the hospital. Okay,
Right.
and and hence, virtual doula support is really picking up demand. Correct. So I would like to start by saying that of all the fears to have surrounding birth and this difficult time we are in, the choice between virtual support and physical support doesn't need to be fearful. Okay, it takes some patience, understanding, and communication, but you can receive the doula support you need virtually. So I will quickly run you through the process of a virtual doula. So during the prenatal preparation sessions,
Yes.
we decide on a format to use like a Zoom or a FaceTime. Right?
Okay.
I
Okay.
accumulate in advance a collection of videos of positions and comfort measures that I would like the partners to learn in advance.
Okay.
There's a separate session which I also conduct about an hour where I kind of train the birth partners, the birth support partners in these positions and comfort measures, right?
Right. Right.
Hospital bags. So I make sure to share ideas, for their birth bags, items that I may carry in my doula bag may not be on my client's list of things to pack. So that's something which I make them aware of. Now, when labor begins, I kind of connect with my client, allowing them to see and hear me. Early on in labor really helps me to establish that trust. Okay, they will begin to see that I'm able to provide some practical and appropriate suggestions, right?
Right.
They will hear the calmness in my voice or see the calmness on my face, and this can be really helpful in kind of avoiding heading to the birth location too early, because as a childbirth educator, as a birth doula, we always recommend our client that try and be at home in the early part of labor as much as possible. You
Okay.
don't have to rush to the hospital, because the minute you rush to the hospital out of that anxiety as to what's going to happen next, you are your clock starts ticking, or the hospital's clock starts ticking, and
Right.
they will start monitoring on hourly basis. You will have those nurses coming in and out of your room, checking your cervix multiple times. You are being tied to the bed, and we don't want anything to happen. So the early part of labor should be at home, and that support is prime for the women that we provide through virtual doula support.
Right.
And I think when and the most important part, that there are a variety of devices that the birthing people can bring to the hospital. Like, for example, laptops, tablets, and smartphones are obvious options. Ideally, I want this to be like a hands-free experience for them. So I recommend my clients and their partners that they may want to keep like a long cord for charging purposes, as well as an emergency battery pack. So they kind of place me in one corner of the room where I can very clearly see the women in labor and the birth partner. I have easy access to which position they are in, and I use then the technology to really guide them and serve them through what are the different comfort measures, different positions. And so it's everything is happening virtually, really.
Right. Wow, that's incredible that you can do so much virtually. It's
Yeah.
absolutely amazing.
If there is a will, there is a way.
Absolutely, that's so true. I know. So I think all this is so phenomenal that the support system is there and you can provide it. So with all the experience that you have and everything that you've done, if there is some advice that you would give mothers to be, what would that be?
Absolutely, yeah, sure. So I think if there's one piece of advice I want to know, is that a doula, as a doula, we represent and believe in your rights as a birthing women and your options, and we believe in you. Okay. We are cheering for you. So when you feel scared or in doubt of your strength or confused in your capabilities, just remember these words, that you are not alone. You are supported, you are celebrated in spirit by countless women like us. You are entering the reigns of motherhood, and we are waiting here with open arms. Lastly, I would say that, do take this time in your pregnancy to own the experience and seek more education and awareness. Know your options in birth. It's very important. It's an incredible, sacred experience, and I hope you really enjoy, every bit of it. So I think those are my some ending points, which I really want to tell to our listeners today.
Wow. That's, I think that's so supportive. I think any mother who is expecting and is listening to this right now will really feel extremely supported. And, I think often, because of differences in opinion, maybe within the partners or within the family, a lot
Yes.
of moms, expecting moms, don't feel supported. And then for you to be able to provide that, it's something that's really needed out there today.
Yes.
So,
I
I mean,
agree.
hats off to you. It's commendable, the job that you're doing. It's truly, truly a great thing that I think that you're doing. So congratulations, and
Thank you.
really, I commend your your work. It's amazing, really.
Thank you so much. And I think really it's a great initiative that you picked up this topic. It's so important that we start educating women that why childbirth education is so important. Today internet is filled with information and misinformation.
Right.
Right? You Google and you get any information that you want. But my point is that pregnancy is filled with so much of anxiety and fear. You are overwhelmed. You are excited at the same time. That it's really important you have a go-to person who can give you the right evidence-based information. And that's really where childbirth educators and doulas, like us, we really play a very critical role. And I sincerely urge women to start taking their childbirth education classes very seriously. Try and always hire, a childbirth educator outside of the hospital, because that ways you are getting information which is totally transparent
Yeah,
and
yeah, I
complete.
agree. Yes. and is different. It's unbiased, I would say.
That's the right word to use. It's unbiased.
Yes, great. So thank you so much for taking the time out and being with us, providing this information, which is so important, I feel. So I can't thank you enough. If there are any questions, I'd like to take them, but I don't think we're getting any questions from the comments. So I think I'll say goodbye. Just
Okay.
a gentle reminder to all the followers that are watching us right now, please do give Mommy Wise a follow, and definitely reach out to Megha for any questions that you have regarding the whole process of giving birth. I think she's doing a phenomenal job. So hats off to you, Megha, and thank you so much
Thank
for
you.
being with us today.
Thank you so much for inviting. It's been a pleasure. Thank you for the
Absolutely.
opportunity.
Thank you. Thank you. Bye.
Bye. Bye.